with you when you get an update.
So a new piece of healthcare technology hopes to accurately identify sepsis among hospital patients.
It's a first of its kind technology that could actually save some lives, and it's getting started right here in Baton Rouge. Here's our Josh Bowering.
Being able to accurately tell a patient whether they do or do not have sepsis is going to be a game changer for emergency rooms everywhere. At least that's what Dr. Mark Lapparis says after spending the last 9 years on the research and development team for this technology.
It's allowing us to identify the sickest people in our department and aggressively treat them. And it's allowing us to identify those that are not quite as sick and maybe pump the brakes a little bit on some of the tests or the treatments.
Sepsis is your body's extreme reaction to an already present infection and, from what I've learned, can be more common than you think.
It's the most common cause of death in hospitals, one of the most common causes for presentation into the emergency department, and probably the most expensive condition that faces hospitals in the United States and worldwide.
According to Dr. Hollis O'Neill, before this new technology, there was no way to be certain if a patient was actually septic or not. I'm told it was like a symptoms guessing game, but now the largest emergency room in the state can have real answers and provide the right care. But how does it work?
It uses a microscope and a high-speed video camera to look at white blood cells as they pass through a system of kind of tiny little channels, and looks at how deformable those white cells are.
In simpler terms, it uses a high-powered microscopic camera to check the squishiness of your white blood cells.
But we were able to identify patients that were sicker than we thought when they checked in, but we also were able to identify patients that were not quite as sick as we initially thought, and were able to discharge them home.
Being the first with the new technology, Our Lady of the Lake performed its first test yesterday, with more scheduled for today and tomorrow. Reporting in Baton Rouge, Josh Bowering, WAFB 9 News.
The doctor we spoke with said he hopes to eventually see this technology in emergency rooms and hospitals worldwide.